Welcome back to our channel, where we discuss senior over 65 health and lifestyle advice. We're delving into a really crucial topic: why skipping meds will quietly worsen critical conditions for seniors over 65. So I'm so happy you're here today. Now, I know daily pill taking can occasionally feel like a chore, and perhaps you have even considered skipping 2 doses or more. But believe me, this is something we ought to discuss, particularly as we age. Missing your meds can have major effects on your health, even just occasionally. So grab a cup of tea, curl up, and let's break this apart together. By the end of this video, you will know why following your meds is so important and how to simplify your own situation. You might now be wondering, why is this such a big deal for those over 65? Our bodies do not bounce back as quickly as they once did as we age, though. Many of us are managing chronic diseases, including high blood pressure, diabetes, or heart disease. Our metabolism slows down, and our organs lose their efficiency. Often the secret to keeping these disorders under control is medication. The CDC estimates that over 50% of seniors take 4 or more prescriptions, while approximately 90% take at least 1. There are plenty of pills to monitor here, but skipping doses puts our long-term health at risk. Not only our chances of a bad day, conditions can silently, without symptoms, spiral out of control until it's too late. This film is therefore for you if you are over 65 or looking after someone else. Let's be sure we are doing all we can to remain active and healthy. What then exactly occurs when you miss your meds? Let's dissect it using 5 critical criteria that, should you deviate from your recommended course of action, can aggravate silently. First, hypertension, sometimes known as high blood pressure. Missing your blood pressure meds can cause your levels to spike, raising your risk of heart attack or stroke, often without any warning symptoms. Second, diabetes. Ignoring your insulin or oral medications will cause your blood sugar to run wild and cause problems, including nerve damage or even diabetic coma over time. Third, cardiovascular disease. Medications that help control cholesterol and heart rhythm are statins or beta blockers. Ignoring them could cause irregular heartbeats or plaque accumulation. Fourth is arthritis. Anti-inflammatory medications or painkillers help to control joint discomfort and swelling. Inflammation can aggravate without them, which makes mobility more difficult. And sixth, osteoporosis. You run more risk of fractures from even a small fall if you are on meds to boost your bones and skip doses. The sinister aspect is, many of these problems do not present clear symptoms at first. For weeks or months, you may feel good, but inside damage is occurring. American Heart Association studies reveal that non-medication adherence results in over 125,000 deaths yearly in the United States alone. This is thus quite serious since of this. Let's now dispel some common misunderstandings about skipping medications. Many people have told me they feel good today and they don't need their pills. The truth is, though, many drugs treat symptoms rather than solve problems. Feeling good indicates that your medications are working. Your condition is not gone. Another fantasy is, I can just double up tomorrow if I forget today. No. That can cause side effects or overdosing and be dangerous. Some believe these pills are just a crutch. I can manage without them. Medications are, however, often a required tool rather than a crutch for chronic illnesses. Ultimately, I have also heard, Big Pharma just wants my money. Although it's natural to doubt things, keep in mind most recommended medications for seniors are based on decades of research and should enhance your quality of life. See your doctor if you're not sure. Do not stop using them just now. Let's dispel these misconceptions and concentrate on what would be best for your health. All right, so should you be alert for anything if you have been missing doses? These are some red flags suggesting possible worsening of your condition. Look for headaches, dizziness, or nosebleeds. For high blood pressure, occasionally there are no symptoms until a significant event like a stroke occurs. Be aware of increased thirst, frequent urination, or unusual tiredness associated with diabetes that could point to high blood sugar. Warning signs for managing heart disease, coughing, chest discomfort, or extreme tiredness include: for arthritis, more joint pain or stiffness, restricting your movement could indicate inflammation getting worse. And with osteoporosis, a minor bump could cause a fracture or unexpected back discomfort. The difficult aspect is that some of these disorders hide from you. Staying to your meds and seeing your doctor routinely is therefore quite crucial. If you see any of these indicators, don't wait. Get help right away. You cannot afford to overlook your health. All right, let's discuss remedies now. How can we ensure that you are maintaining these conditions under control and not missing your meds? Sort first. Store each day of the week in a pill organizer with sections. They are game changers and reasonably cheap. Program your phone to remind you daily, or pair your meds with a daily ritual, like brushing your teeth or eating breakfast. Second, let your doctor know. Tell them if you find side effects from medications or if you find meds to be expensive. There might be substitutes or help schemes. Third, call on a loved one. Ask a friend or relative to follow up with you regarding your medications. This is about support, not about nagging. Fourth, if at all possible, streamline your routine. See your doctor to find out whether you might combine drugs or change to once-a-day pills. And fifth, keep learning. Know the significance of every pill. Have a handy list of your medications together with their uses. There are even programs like MediSafe, which track your dosages and send reminders if recall is difficult. Medication management is another area where the National Institute on Aging offers outstanding tools. Let's make this as simple as it can be, so you might concentrate on enjoying life. Let us sum this up. High blood pressure, diabetes, heart disease, arthritis, and osteoporosis are 5 critical conditions for seniors over 65 that we have discussed why skipping meds can quietly worsen. We have dispelled false beliefs like, I feel fine, so I don't need my pills, and stressed warning signs like vertigo or unusual tiredness. Most importantly, from using pill organizers to setting reminders and visiting your doctor, we have offered useful advice on how to keep on target. My strongest recommendation is view your prescription schedule as a non-negotiable appointment. It's about safeguarding your health and remaining independent for as long as you can. Not only about swallowing pills. Remember, little deeds today, like following your meds, may help to prevent major issues tomorrow. Since you have worked so hard to reach this level of life, let us make sure you are here to savor each moment with your loved ones. Many thanks for viewing, friends. Should this video speak to you, kindly mark it with a thumbs up and forward it to someone who should hear this. Let's start the conversation on the need of following our medications. Remember also to subscribe to our channel for additional senior over 65 health advice. Set that alert bell so you never overlook a video. In the comments, I would be happy to hear from you. Have you ever had trouble remembering your meds? For you, what tips are effective? Alternatively, if you have questions, put them under here and I'll try to respond. Let's continue this dialogue. Stay strong and healthy. I will see you in the next video.